Chapter 28, Health Policy and Health Informatics. Informatics focuses on technology as a tool with the goal of an efficient, cost-effective healthcare system that ensures health and healthy communities for the individuals, families, groups, and communities. As a result, health policy in the United States is an ever-changing reflection of the interactions and negotiations between the many health IT-related stakeholders. The United States Department of Health and Human Services, HHS, is the United States government's principal agency for protecting the health of all Americans and providing essential human services. The ONC develops and coordinates federal health IT policy to achieve national health priorities that are set by the White House and the Secretary of the Health and Human Services. And it implements statutory requirements such as those identified in the HITECH Act and the Medicare Access and CHIP Reauthorization Act. Each of the following are forces that help determine health IT policy in the communities that nurses serve throughout the United States. An increased focus on patient safety began back in 1999 with the Institute of Medicine's report "To Err is Human." In 2011, the Institute of Medicine's report "HIT and Patient Safety" states that safe use of health IT relies on several factors, including clinicians and patients. Safety analysis should not look for a single cause of problems, but should consider the system as a whole and consider the interplay of people, processes, and technology when looking for ways to make it safer. Unintended consequences are identified as positive, negative, or neutral unanticipated outcomes occurring as a result of a planned activity or an event. The National Priorities Partnership, NPP, is a collaboration effort of 51 major national organizations that bring together public and private sector stakeholder groups as partners in a forum that balances the interests of the consumer, purchaser, health plan, clinician, provider, community, state, and supplier in achieving the aims for better healthcare, affordable healthcare, and healthy people and healthy communities. The National Quality Strategy recognizes health IT as critical to improving the quality of care, improving health outcomes, and ultimately reducing healthcare costs. Healthcare professionals and informaticians have a professional responsibility to participate in the development and implementation of effective health policies. These policies maximize the use of health IT and empower clinicians and patients as partners for health. In 2014, the American Nurses Association, the American Academy of Nursing, and the American Nurses Foundation launched a national coalition to place 10,000 nurses on governing boards by the year 2020. The Nurses on Boards Coalition is a group of national nursing organizations working together to increase nurses' presence on both corporate and nonprofit health-related boards of directors throughout the country. The goal of this effort is to bring nurses valuable perspectives to governing boards, as well as state level and national commissions with an interest in health. Regulations and the rulemaking process are used to clarify definitions, authority, eligibility, benefits, and standards. Their development is shaped by the monitoring, involvement, and input of professional societies, healthcare providers, third-party payers, consumers, and special interest groups. Another mechanism for advancing health policy is through the development and publication of position statements. Sometimes these are called policy briefs. A position statement is an explanation or a recommendation for a course of action that reflects an organization's stance on an issue of concern. Position statements are typically developed after an internal discussion with content experts. Then they're advanced to the broader membership for review and input, and then finally submitted to the Oversight Governance Group or Board for approval. Health informaticians working together within professional associations bring to the health policy table a deep understanding of the clinical processes, technology, and health IT systems. They also experience as advocates for patients, groups, communities, and populations. These leaders have a unique opportunity and a professional responsibility to share this information technology with the goals of advancing an improved health system that is increasingly focused on value-based care. Health practitioners require certain skills to be able to communicate effectively with policymakers and to take advantage of relevant advocacy opportunities. The tipping point in nursing care is calling for the nursing profession to be re-engineered with a more educated workforce capacity. The Future of Nursing Campaign for Action is an initiative to advance comprehensive healthcare change. It envisions a healthcare system in which all Americans have access to high-quality care, with nurses contributing to the full extent of their capabilities. Nurse leaders should be engaged at all levels in health IT policy and strategy setting committees and initiatives. In addition, nurses must be knowledgeable and well-versed in current public policy initiatives and seek opportunities to participate in advocacy and educational efforts directed toward policymakers. For removing barriers to practice and care, there are still significant barriers that exist to allow the full practice of advanced practice registered nurses. Nurses need to work with other professions to remove scope of practice restrictions. Transforming education recommendations are to provide pathways to the BSN degree, fund residency programs, promote doctoral degrees emphasizing the PhD, and promote interdisciplinary and lifelong learning. Collaborating and leading, nurses are encouraged to serve in executive and leadership positions. Continued efforts are needed for interdisciplinary collaborations and leadership development. Promoting diversity, while many organizations have increased diversity, continued emphasis is needed. Improving data. Data collection is needed about numbers and types of health professionals, their roles and places of employment. More organized data sets are needed. Whatever their role, healthcare providers and informatics specialists must be confident that they can influence health policy at the local and organizational, regional, state, and national level.